Like many parts of the country, Central Ohio is right in the middle of a real heroin crisis.
The Franklin County Coroner's Office, along with community leaders, are working on a plan to help stop the death toll from rising even more. Tonight, NBC4's Courtney Yoon takes us to the Opiate Crisis Summit.
The heroin overdose rate has reached a critical mass here in Franklin County. That's why the coroner's office has put together the Opiate Crisis Summit. It's bringing together healthcare, law enforcement, education, even the justice system, all to come together to make a community action plan to stop these deaths from happening.
There were so many times I hated using and couldn't stop. I hated it.
Vanessa Perkins is a little more than 6 years sober, but just a few years ago, she felt worthless.
I put too much dope in the needle and injected myself with it and somehow woke up. And I was mad about waking up.
She was trafficked in the Franklinton area, used for sex. She says catch court saved her life, getting her into treatment when she was arrested for solicitation in 2009.
Instead of me being this stupid girl, which I always believed me to be, just this stupid girl, this dumb, no good drug addict, prostitute, no good mom, they taught me that this is a disease of addiction.
Today, she's an advocate, passionate about educating the community on the realities of addiction. She even works at the courthouse for the same prosecutors who put her in jail.
All the people that I used to be terrified of are in this room, in the room that I just spoke in, to address the sickness instead of just locking them away, I think is huge.
The Franklin County Coroner's Office tells us that in 2015 that there were 310 opiate-related overdose deaths. As those red bars there, you can see that's about 100 more than those blue bars in 2014. And they're hoping today at this crisis summit that they'll be able to decrease those numbers. In Columbus, Courtney Yoon, NBC4.
Courtney, thank you. Now, the government is working to spread the word about the risk of opioid pain medications. The Food and Drug Administration issued some new guidelines. Drug makers must include warnings on the products about the possibilities of abuse, addiction, misuse, overdose, even death. The guidelines also encourage physicians to try other methods for treating pain before prescribing an opioid.